It seems like a device that is fairly simple to use. I like the wheels, that you can bring it right up to the baby rather than bringing the baby to the instrument. It needs to be something that's easy to clean. It needs to be long enough, so depending on what the environment that you're making the measurement is. And the fiber optics need to be robust.
How we arrived to this device? I would say there were 3 steps to that. One was the identification of the correct optical technologies, diffuse correlation spectroscopy and time-resolved spectroscopy. 2 was our clinical partners telling us that they would be interested in having these 2 things together to measure oxygenation, blood flow and metabolism. And number 3 was they telling us what kind of a device was needed. This uses 2 optical technologies. One of them, diffuse correlation spectroscopy, uses laser light and speckles, which are the black and white dots that it creates and that they fluctuate in time, to measure blood flow in the body with optical fibers. Number 2 is a time-resolved spectroscopy. It sends in a pulse of light at multiple wavelengths and it detects the amount of oxy and deoxyhemoglobin in the body to measure blood oxygenation and blood volume. And it has a touch screen. All optics are hidden inside the box.
The instrument that I currently use is about the size of a small refrigerator. But it's on wheels, so that's okay. We can make room for it. The power of the DCS is a little bit of a problem. We have to always think about the skin and how much energy and heat we're putting on the skin. The value of the flow measurement is essential. There is a link between the blood flow and the oxygen consumption. So if the cell is using more oxygen, it'll demand more blood flow. And by measuring both, you can understand that if the blood flow goes up and the oxygen saturations go down, that the tissue is actually using more oxygen.
Within the Babylux project, of course, the next step is to take this mock-up right now has no optical components in it. To take the optical components that are lying on the laboratories in our labs, embedding them into a real system, constructing this system, and then testing it on phantoms. These are materials that appear like tissues, so we can control their properties precisely. And then once that's done, to take it to Denmark and to Milano and to do measurements on the babies.
What advice would I have for the developers? Well, one advice I'd have, I'd very much like to use this clinically, so I would advise them to let me use it.